वेलकम, खुशामदीद। एक बार फिर हाजिर हैं आपके लिए एनालाइज दिस के साथ। और आपका होस्ट शमून अली और हमारे गेस्ट नदीम कुरैशी साहब आज फिर मौजूद हैं हमारे साथ। सॉरी, हम लोग लास्ट वीक आपके लिए शो नहीं कर सके। मैं असल में कुछ अपने प्रिपरेशन में मसरूफ था। कुछ मेरी पर्सनल एंगेजमेंट्स थी जिनको मुझे टेक केयर करना था। तो इसलिए हमारा शो नहीं हो सका। लेकिन हम आपके साथ फिर जुड़ गए हैं, फिर आपके साथ बात करेंगे। और इस मर्तबा हम बात करेंगे आपसे साइड इफेक्ट्स की, जो कि कोविड 19 ऐसे तो एक डिजीज जो है वो है, लेकिन उसके साइड इफेक्ट्स इन टर्म्स ऑफ क्या आपको लॉकडाउन होना पड़ा, आपको घर में रहना पड़ा, या आपके सोशल रिलेशनशिप्स में अफेक्ट आया, या आपकी इस तरह की चीजों में जिंदगी में जो अफेक्ट आया, उसके बारे में हम बात करेंगे। तो नदीम कुरैशी साहब, आप शुरू करें, जरा हमें बताएं कि आपके पास आज कुछ इंपॉर्टेंट इंफॉर्मेशन थी जो आप मेरे शो शुरू होने से पहले बता रहे थे, तो वो हमें बताइए जरा।
It's COVID-19, as we were talking earlier, just discussing, has governments have failed to sort of really calculate the actual effects on the mental health of people that some of the COVID-19 restrictions have had in terms of lockdown. There have been an increase in suicides, and people have committed suicide as a consequence of some of the restrictions. There have been people who were isolated and who were taking drugs. Now they weren't taking those before. They're taking antidepressant drugs. The main two things that are the main two mental health problems that the COVID-19 has created has increased as well is depression and anxiety. More than 6 million people in England now receive antidepressants. And this is the highest figure on record now because of this COVID-19. And this is thought to have been down to counselling services going down as well. Because people are not being able to attend their face-to-face counselling appointments, they're now reverting to drugs now, so that the counselling appointments have come down. So where the counselling was sort of keeping them away from the drugs, now they've got drugs. Now they're being dependent upon drugs to keep them, keep their anxiety low or keep their depression low. So this is not really healthy for society. And then secondly, COVID-19 restrictions are going against the isolation and the self-isolation, and all of this is going against the very sort of way we are as human beings. It's going against our very human nature, and that in itself causes a lot of problems as well, and that's been mainly at the root of the problems. In some of the people who already had mental health problems, they needed group therapy, and now they can't have access to group therapy anymore. Some people are not, they say, yes, you can have online counseling, but not everybody can do online counseling. They cannot, not everybody has a computer, for instance. So there's so many inequalities, even in terms of being able to offer support to people. And then secondly, people need that physical, that social interaction to be able to help them with their mental health problems. And so this is adding a lot of pressure on mental health services as well.
Well, the human beings are known to be social beings, right? Like we need connections, we need interactions. हमें एक दूसरे की जरूरत होती है, इसीलिए हमारी फैमिलीज होती हैं, दोस्त होते हैं,
Yes,
वर्क
absolutely.
कॉलीग्स होते हैं। ठीक है, तो ये तो ऑब्वियसली बात सही है कि जब हमारी उन सब लोगों से कनेक्शंस कट जाएंगी तो उसका अफेक्ट तो आएगा।
Sure. It's the trouble is with this. It's the longer that people are facing these restrictions, the more severe and the more complex their problems are going to become. So, you might be normal now, and I might be normal now, but we're going through these self-isolation, and if we don't have any close family and friends or etc., we're going to be affected really badly. Or if both of us have led very highly active social lives, and then all of a sudden that's taken away from you, that's going to have an effect on your health. There's going to have an effect on the way you are. So all of that is affecting people. And then there's a whole host of other areas where COVID-19 restrictions have actually affected people in terms of jobs, in terms of their house. If they've got no money coming in, how are they going to pay the rent for the house? How are they going to pay the rent for the apartment? all of this all adds up, and it's just sad to see that the real pandemic, to me, having, I'm working with a mental health organization myself on a personal level and on a professional level, and the thing is that it's sad to see that it seems to me, and it's sad to say this, but the real pandemic is not the COVID-19, it's the mental health problems which have been caused as a consequence of the COVID-19. They've been the real killer, and people are dying as a consequence of some of the mental health problems that are being caused due to the isolation.
आपके ख्याल में sorry, I'm getting my volume back. Can you reduce the volume a little?
Sure. Okay.
Okay. So आपके ख्याल में क्या आपको लगता है कि in terms of family relationships, how do you think family relationships have changed due to COVID?
Family relationships, from personal experience, I know there's people who've stopped meeting their parents because they're afraid that they may pass on, and especially if their parents are very elderly, they're afraid they'll pass on any kind of virus that, they might have tested positive, so they won't be meeting their parents. So parents are missing out on their children, interaction with their children. Grandparents are missing out on interaction with their grandchildren. All of that is placing a lot of strain, if you like, on the relationships as well. I know there's a family I personally know that one of the sons who is looking after the mother, he lives in the house with his mother, but he's prevented all the other brothers from seeing the mother. So all they can do is that she waves to them in the window, and they go past every day, and that's how they meet. So yeah, and then it's going, like I said, a lot of the COVID-19 restrictions are going against human nature. I think there needs to be some kind of a balance, and we need to get help out to those people who are isolated, especially the elderly, and especially some of the vulnerable groups that don't have access to technology. They don't have access to the social relations. Not everybody has huge families. Not everybody has family or friends that they can depend upon, and those are the people that we really need to reach out to help.
I think in the final part of our program, we can go through the discussion of what can be done in terms of helping those people.
Sure.
For now, let's talk about the situation where now there are people that are following the restrictions, and you gave an example of the grandma that she can't see her kids and stuff. She's going through the window, saying hi and everything. Then there's the other end of the spectrum. People such as anti-maskers, right?
Yes.
People that don't believe on the pandemic. People that are still trying to live normal lives, and they want to go out and they meet people. And I mean, there are people like that. Just recently, news in Canada, the Ontario's finance minister took a vacation while telling everyone that you should stay home.
All right. Okay.
So he came back from the vacation and he had to resign. And there is a big debate going on, and in terms of how politicians that are public representatives should lead by example and not just lecture, and they have to follow through with their own actions, not taking vacations and enjoying their life while telling everyone to buckle down and lock yourself up.
Sure.
Right. So there are people like that too. There are people, not just politicians, there are generally people that you may know. There are certainly people that I know that don't believe that they will be impacted. They think oh yeah, if you're gonna die, we're gonna die, right? How does that affect the overall image or picture for people that are actually following, and how does it impact the pandemic in your mind?
I think where the problem lies is not with the people. I think the problem lies with the government. And I think if the government says do this, then they need to enforce it. The problem doesn't lie with the people. I think that's where people are thinking wrongly about what the issues are with COVID-19 and its restrictions. It's not about the people. It's so in China, for instance, right, the government is very strict. If it says, right, we're having a lockdown, it means we're having a lockdown. And it means you can't do this and you can't do this and you can't do that. And if anybody does this, they'll be either put in bars or they'll be either deported or whatever. They will, the government will take swift action on anybody
Hmm.
breaking the rules of any kind of restrictions that they've placed as a consequence of the virus. So in that respect, I don't think it's about the people, Shamoon. It's more about the government enforcing those rules. And you've quite rightly picked up on that one issue of the minister sort of going off, and he's gone off on vacation, and he's the very one who's saying to everybody else, do this and do that. So when you have situations like that, it builds also distrust in the system, and the distrust comes back. This person's gone off on vacation, so was he telling us the truth in the first place?
Yeah.
So you see that there's that side of it as well. So it builds a bit of skepticism and distrust in the government. And is the
Yeah.
government telling us the right thing about COVID-19 now? So the people start asking those questions. So why should we listen to the government? Do you see the government creates that situation for itself, that it
Yeah.
creates this distrust within its own people by not giving the right information or by not enforcing some of the restrictions that it's put into place.
Well, it comes across like that. Like if you think it's a serious pandemic, you think that everyone should stay home, and you're advising everyone based on the knowledge you have received, information
A-
you have received. Then
Absolutely,
based on that same information, how can you make decision
that's
to
right.
risk your own life
Yeah.
by going on vacation?
Yes, but the effect of that is, like I said, the biggest danger with that is people now don't trust you. People now they won't just trust him; they will not trust the government to give them the
Yeah.
right information. Do you see what I mean? It just doesn't. See, when people behave like that, they don't realize that it's not going to affect. It's not just them. It's going to affect the whole of their party or the whole of their government in
Hmm.
power. That people will now trust politicians less because there'll be other politicians who'll be doing similar things, but they've not been reported.
Hmm. Interesting. Now, other thing I wanted to ask you, like, let's consider that part of the reason that everyone is going through this pandemic, and you know everyone is stressed out and worried, right? And some people are staying home, some people are not listening to the guidelines and doing whatever they want. So doesn't it kind of create inequality, which can be another cause of frustration in your mind?
It does, but I think that's normal human nature. You'll always have people who will break the rules in any one situation. So people, there's a law which says that you should not steal, but people do it. It creates inequality. There's a law that says you can't. People commit fraud. There's a law that says you can't kill people, but people kill people.
Yeah.
So the laws don't. The laws are going to be there, and there will always be people who break those laws. What it is for the government in these kind of situations is they should be very strict in enforcing the laws. If they've put any restrictions in place, they should be very strict in sort of enforcing those restrictions.
Hmm. They need to follow through with their restrictions, and they have to follow through for
Yeah.
everyone equally. Now,
Or
another thing that
or
you
they
mentioned,
say that this is we need to strike a balance, or they be sensible about it, and they can sort of say, right, okay, you don't have to stay at home. You can go for your walk, do this, or produce very clear guidelines and help people to cope with that situation. To sort of say, this is what you can do, because what they're saying is, what they're not doing is they're not giving anybody the guidance to sort of say, this is how you can organize your day during the
hmm,
pandemic. Okay, this is how you can get across your mental health. They're not doing that. What they're doing is, you can't do this, you can't do this, you can't do this, you can't do this, you can only do this, you can only do this, you can only do this. Very negative, 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 negative. But it's not saying what I can do.
yeah, it's not giving you way out.
It's not giving me a guidance as to what I can do. So people are now confused. Okay, they're sort of saying, on the one hand, he's saying, I shouldn't go out to work. But on the other hand, he's saying, I should go out to work.
Hmm.
And in UK, there's been major confusion, and that has caused a great deal of distrust in the community. I mean, I was out yesterday, Shamoon, and yesterday was New Year's Day, and the the park where I attended with my grandchildren, two grandchildren. It was full of people. There's so many people there, very crowded park. And the canal walks, people walking on the canal. So many people. You would not have believed that Bradford is in tier 3 restrictions by looking at that. So do you see what I mean? So that is created because some of the restrictions and the way the people that have been reporting these restrictions has created a lot of distrust within communities to be able to follow through on those restrictions. And then there will always be people who sort of say, right, this is nonsense. I don't believe in this. This is a major conspiracy theory. I will not believe in this, etc. So you will always have that crowd as well. And there will always that crowd. But the only way that you can get across it is that the government sort of says, right, okay, fine. If you're not going to listen this way, we're going to have to enforce it very strictly. And yes, in UK now, they have started to enforce. People have been receiving fines of up to £10,000 when they've been caught having large gatherings, etc. So yes, it has been enforced in certain areas, but it's not enough. But for me, on the individual level, it's about producing very clear guidance and information for people to prevent them from suffering from mental health problems. That needs to be very, very clear now. That the major demand for that is what you can do, and I would go as far as saying organize the day for the people. If they're at home, what does an elderly person do then? What was their lifestyle before? If they were grandchildren, how can they meet their grandchildren? And how can they talk to them? How can they relate to them? But people have just been left to their own ideas and ways of deciding how they're going to do things. And those ways, they may not have even had to do that because the virus in some cases, and some doctors say that the paper mask doesn't even do anything. So there's reports of doctors, experts, who are saying the paper mask doesn't help you. How does it prevent the virus from spreading? It doesn't. You need a proper mask which does prevent the virus. So there are masks which do prevent it, but then there are masks which don't prevent it. So they said the masks that the hospital staff wear, those are the ones that do prevent it. Yeah.
See,
So sometimes the equipment is, yeah.
That's again where I'll come back to the confusion part, right? Because what keeps happening is that there's so much information and so much conflicting information that it gets confusing for people to figure out what does work and what doesn't work. In regards with masks, right? There was CDC's initial guideline that said don't wear masks, right? Leave it for the people that are dealing with the pandemic, like first essential services workers, people that are healthcare providers, people that are first responders, people like that need to wear masks, right? Later on, they changed their strategy and they said, well, you should wear a mask, right? And then they went like, oh, you should wear a mask because, even if you have it, you might not know it and you may be spreading it. So by wearing mask, you're preventing other people from getting it, right? Then still there was confusion. Are you wearing masks to prevent from getting it yourself, or you're wearing masks to prevent other people getting it if you have it, even though you don't think you have it, right? So
very confusing.
Yeah, exactly. It within the span of this 1 year, there has been several different informations based on several different fact-based logics that have been presented to the public, and public being public does not always receive it the same way, right? Which again comes back to the confusion, and confusion over extended period of time, and not clarity about what the future holds over extended period of time would create people with stress and depressed personalities. So now you were saying that you are working with one of the mental health organizations, and what steps are being taken? As you mentioned, that there are steps being taken to prevent the pandemic from spreading, but they're not clear. Are there any steps being taken to consider for the mental health issues that are originating because of the pandemic? You mentioned about mental health issues that are existing, pre-existing, and maybe frustrated during the pandemic. But what about the issues that are coming up because of the pandemic? Sorry, I can't hear you.
if I was to go through with you just some of the issues that are affecting as a consequence of some of the drivers of the worsening of the mental health condition during the pandemic. One is obviously we've been talking about the social isolation.
Hmm.
So it's social isolation has been potential for sort of detrimental effects other than loneliness. There've been, for example, serious concerns about victims' domestic abuse being locked down with perpetrators. So people suffer from domestic abuse where the husband might be, if you like, prone to sort of committing domestic violence against his wife. They're being forced to live together because they're self-isolating. So it might make the situation worse for them. So there's issues like that which aren't even coming to which have come to light as well. So a report by MPs found that 16 people, 14 women and 2 children were killed in the first 3 weeks of lockdown, and calls to the National Helpline Refuge were 49% higher than usual. And this is an unintended impact of the lockdown that urgently needs further study and action to safeguard those at risk. So you have those kind of situations, Shamoon, where those are byproducts of this COVID-19 restrictions and isolation. So you got the isolation, then you have within the isolation there are groups of people like those suffering from domestic violence, and as I've said, there's people have been killed. 14 women and 2 children killed in the first 3 weeks of lockdown. And you got and the calls to the National Helpline Refuge were 49% higher than usual. And this is the kind of impact that this COVID-19 is actually happening, which is aside from the usual times of depression and anxiety, so that people experience as a consequence of it. So in terms of jobs and financial losses, the economic impact of lockdown has hit people unequally, and it's causing immediate impacts on the mental health. Mental Health Foundation here in the UK has found over about a third of the people in full-time work surveyed were concerned about losing their job, and the mental health impacts on people who were unemployed were widespread and severe. And then there's people, Quarter reported that a Quarter reported not coping well with the stress of the pandemic, twice as many as those in employment. So people who are unemployed were basically reported as not coping well with the stress of the pandemic than those, and there were twice as many of those as those who were employed. But almost half were worried about not having enough food to meet basic needs, and 1 in 5 people interviewed had experienced suicidal thoughts. So all of these things, aside from the depression and anxiety, all of these things are happening as a consequence of lockdown as well. So you've got all these, and then the housing and insecurity and quality. People's housing and their ability to afford housing are strong influences on mental health. And those people who who rent have experienced greater financial impacts during the pandemic than those who own their own homes. So another example of driver of poor mental health is that that is socioeconomically patterned. During the lockdown, people have spent far more time than usual in their homes. Quality of housing and the opportunity it affords, including personal and outdoor space, are highly variable. For example, 1 in 8 households, 12% in Great Britain, have no access to private or shared garden. So what are these people going to do? And then and black people in England are nearly 4 times as likely as white people to have no access to outdoor space at home. 37% versus 10%. So you've got these kind of great inequalities where people who don't even have a backyard where they could do some exercise, or they could go for a walk or whatever, they're stuck inside their homes. The other thing is that if you're working in a frontline service as a staff, it's basically there's an increase in mental health problems for these people suffering, and they're suffering from depression, substance misuse, and post-traumatic stress disorder, or frontline health and care workers. We for frontline and healthcare workers, and these are these frontline health and care workers are suffering from depression, and they're suffering from substance misuse and post-traumatic stress disorder. And it goes on, and there's a loss of coping mechanisms. People are getting to a point where they can no longer cope with some of the isolation during lockdown. There's also, Shamoon, one of the things I wanted to sort of say was as an organization, we get calls on from other organizations to help them with with counseling or therapy work. And we had one call from and from Muslim burial service, Shamoon. And this Muslim burial service, the volunteers that work there to bury some of the people, they had an increase in the burials because of COVID-19, people dying from COVID-19. So there's an increase in burials. And those people, because they were constantly trying to sort of cope with the restrictions as well as do all these, they were overwhelmed mentally themselves, and it was taking a strain on them. And we had a call from their organization to sort of say, can you help out with providing therapeutic support for our workers here? So these kind of things have started to happen, which never happened before. That everybody is being affected by it, whether you're working, whether you're not working. You're living in a house, and how it depends on where that house is. Do you have a back garden? Do you have a front garden or not? So all of these things are creating additional issues apart from the depression, anxiety. You have all of these issues going on as well.
Yeah. Even household arguments, fighting between the couples, husband and wife fighting with each other, that has increased too, because both of them are sitting at home now, and they're basically at each other's face now.
Yes, absolutely. And this is, like I said, the example I gave you was extreme. 14 women were killed, and they were already suffering from domestic abuse. But the first 3 weeks of lockdown, we had 14 women killed and 2 children killed as a consequence of, their partners being violent.
Yeah.
Violent
Now
towards them.
there is another aspect that is not being discussed that much, but still is part of the overall impact, which is people that are waiting for their spouses to come from overseas. So people that may have applied for immigration for their wives or husbands, right? That's been happening in Canada too, that because the immigration services have basically listed on their website before there was 1 year time after you apply to get your spouse over or their application to be processed. Now they have listed that due to pandemic, there is no time restriction. That being said, there is so much uncertainty as to when the applications would be processed. I don't know if something like that is happening to UK too.
UK is worse. We're not even dependent upon the processes now. There's simply a flight ban, and in UK, you can't at this moment in time. You can't fly out. Basically, Pakistan. There's a flight ban to Pakistan. There's nobody that can fly to Pakistan now. So everybody that might change on Monday. So no flights coming over there. No flights going the other way neither. So we don't have a situation where you forget the process. Some people can't enter into the country. Full stop. Nobody can enter into the country, and nobody can leave the country. So
yeah, Canada has cancelled the flights from UK too.
Yes, yeah, they've 40 countries. 40 countries have banned the UK people flying from the UK to their country because UK is being targeted as one of the places which is worse for the pandemic.
All right. So okay, well, we have a couple of minutes left. Why don't we bring the program to close? You tell us your last words for today, or what you conclude the program to be.
I think what we need to perhaps one of the things I would like to see is more clear guidance, and certainly I think we as an organization will be producing some of that guidance to help people through. We provide one-to-one support for people suffering from mental health problems. We provide group therapy support, and we try and work with other organizations in making sure that people who are suffering from mental health problems are receiving the support and the help that they need. But at the same time, I think without that clear guidance from a government level, people are going to continue to suffer these problems. And secondly, without any more further support from the government in terms of people on the ground being able to help people with mental health problems, there's going to be trouble as well. And secondly, the government is really going to have to rethink how it needs to approach people with mental health problems. Can we allow face-to-face, with mask wearing, or whether can we allow face-to-face group therapy work or whatever with social distancing? Can we bring that back again? and do that as much as possible. And if the government can rethink some of that strategy through without just having a blanket sort of policy, then I think we've got some hope in the future to help people.
Very good. So my conclusion for today would be that I think the governments have gone about dealing with this pandemic in a frustrated and unplanned way. There was lack of clear plan, and when they did enforce the lockdowns, I'm not against lockdowns, by the way, just to make it clear. The lockdowns are understandable. However, the dealing with the lockdown is not done well. There had to be designed programs that should have been rolled out in order to assist people that are going through the lockdown, and which was not done by any of the governments, which was sheer lag or lack from the government's part. So I think we'll conclude our program at that. Thank you very much for Nadeem Qureshi to join us. It was very informative. The information you gave us very useful, and hopefully you yourself, our viewers, are taking care of yourselves, taking care of your mental health, besides being home, besides taking care of your physical health by avoiding getting in the grip of pandemic. I'm hoping that you're also taking care of your mental health, creating activities and keeping yourself busy in such a way that you don't get overly compromised mentally. We'll conclude today's show. We'll meet you again next week, inshallah. Thank you very much. Okay, take care. Khuda Hafiz.